Hi everyone, welcome to Unified OSCE YouTube channel where we make OSCE simple. My name is Funke and today I'm just going to be taking us through what OSCE is all about, what does it entail. Now, before I go ahead, the first thing when it comes to OSCE in nursing is you learning how to do your hand hygiene following the 7-step technique of WHO. If you go to our YouTube channel, you will see videos of hand hygiene using both hand gel and water. So that should be the first thing you should learn. Now, OSCE stations, there are 10 stations, and these 10 stations are a combination of both silent station and talking station. Now, you wouldn't know whether you are going to have a silent station or a talking station, but the thing is, you are going to have both silent station and talking station. There is a time frame for each of these stations, and of course, you have to show your competency, you have to show empathy as well, and you have to be conscious of your time. Now I'll talk about these 4 stations. I'm not saying that when you go in for your exam you're going to start from these 4 stations, but I'm starting with the 4 stations because they are kind of linked together, and that is the station we call APIE. The A stands for assessment, the P is for planning, I is for implementation, and then the E is for evaluation. Now, in assessment, there are different topics that your scenario can actually come from. It could be a scenario on asthma, it could be homelessness, it could be dementia, it could be ectopic pregnancy, it could be maybe hernia, it could be fall and fracture. So it could actually be from any of those topics. Okay, now apart from that, this assessment is divided into 4. I'll say that let me say there are 4 types, so to say. Now you have a scenario that you're only going to use your news chart, okay, and then you could have a scenario that you're going to use TCS chart, that's like you doing a neurological assessment, and then you could have a chart where you're going to do a nutritional assessment, that is your MOS chart. When you have your MOS chart, you're going to have your news chart together with the MOS chart. And then the 4th type is when you have your patient health questionnaire chart, which is like a mental health assessment. And when you have a PHQ-9 chart as well, you will have a news chart together with it. Now, what is expected of you to do in assessment? You're going to check your patient's observations, the blood pressure, the heart rate, the respiratory rate, capillary refill, oxygen saturation, and then there are some other questions that you need to ask your patient as well. And in all this, you have to follow the A to E approach. That's the airway, the breathing, circulation, disability, and exposure. And assessment station is a talking station, and it's 20 minutes. So now, I said these 4 stations, they are linked together. I'll call them APIE. The next one is your planning station. In planning station, it is a silent station and it is 14 minutes, and it is just expected of you to come up with 2 nursing problems for your patient and then solve those nursing problems in a space of 14 minutes. The next one is implementation. In implementation, it's just about you administering medication to that patient, either by following the 7 rights of drug administration or the 8 rights of drug administration. You have to administer the medication safely. You have to ensure that you sign your chart before your time runs out. And implementation is a 15-minute station. So like I said, it's all about you giving medication to your patients. And there are some safety checks that you need to do when it comes to implementation. There is a YouTube video on implementation station as well on our YouTube channel, so you can have a look on that as well. The 4th station is evaluation. Now, evaluation is like you handing over to someone else, telling the person about the patient, and you have to follow ESPA. That is talking about the situation, the background, the assessment, and of course, what is your recommendation? It is a talking station, and is the assessor that you're actually going to hand over to in your exam. And you have to be time conscious when it comes to evaluation because it is just 80 minutes. So those are the 4 stations that are linked together. Now, apart from those 4 stations, you still have 2 skill stations. Okay, you have 2 pairs of skill station, that is 4 skills. Okay, 2 pair of skill stations, that is 4. Now with the first 4 making 8, and then you have another station that we call professional value station, and then you have the evidence-based station. Now for the skills, there are different type of skills, and you wouldn't know which one you are going to have in your exam, so that means you have to know every of those skills. Yeah, the skills are quite many. You have, it could be aim, that is your inhale medication. It could be ANTT, which has to do with wound dressing. It could be peak flow reading. It could be intramuscular injection. They are quite numerous, so you have to learn each of those skills, and for each of those skills they have a time frame. It could be 8 minutes, could be 12 minutes, it depends on the scenario. But like I said, you are going to have 2 pairs of those skills. That means you are going to have 4 skills, and then you have your evidence-based station, and then you have your professional value station. The evidence-based station is a silent station, and it is just 10 minutes. There are different topics, about 10 subtopics that you can have your question from in evidence-based. Likewise, in professional value, there are different topics that your question could actually come from, and you have to make sure that you familiarize yourself with each of those topics that your question could come from. Like I said, you wouldn't know, of course, it's an examination, so that's why you have to really prepare very well, and then ensure that you actually know about all those skills, you know about all the topics in professional value station and all the topics in evidence-based station. So, and that is just it. It's 10 stations. It's like a single room. When you go into the station, you finish the first station, then you go out, and then you are called in for the other station. Now, like I said, you could start from anywhere. You could start from professional value station, you could start from skills, you could start from assessment. But the good thing when you start from assessment is you will know that the next one will be planning, and then it just follow like that, sequentially. Yeah, that is just it. If you have any question, you can drop it, and if you actually gain something from this video or any of our videos, please do subscribe, like, and share. Thank you.